Good afternoon, and thank you for joining us for today's CMS 1500 Q&A compliance session. I'm Sarah McDonald from the Stakeholder Engagement Unit at the Workers' Compensation Board. To assist with your questions today, we have several board staff from our Medical Director's Office and our Data Management and Analysis Office. After a brief overview of provider responsibilities as they relate to the mandate and the significant benefits of electronic submission, we will review the most frequently asked questions and then turn the bulk of the session to answer any additional questions you have. If you have not obtained an electronic submission partner, we urge all providers not to wait any longer, and today's webinar is designed to answer any questions you may have and help you understand and comply with the mandate. We ask you to please keep your phone lines muted, as we'll be using the chat feature to receive your questions at the end of today's presentation. You may enter your questions throughout the presentation in the chat box located on the right side of your screen. We will answer as many questions as we can, but if you have questions that we don't get to today or you think of something after the session ends, we'll be providing you with resources at the end of the presentation. A recording of this webinar will also be available on our website and YouTube page in the coming days. But before we dive into today's presentation, we would like to get some specific feedback while we have you. If you are not already submitting CMS 1500 bills through an electronic submission partner, what is holding you back? Please let us know in the chat. So let's get started. As we mentioned, the mandate to submit bills electronically through a board-approved submission partner went into effect last week on August 1st. Today's presentation is geared towards providers who have not yet partnered with a board-approved electronic submission partner. We will start with a brief overview about what you need to do to have achieved compliance, and then review the top questions we have received. We will then spend the rest of the time answering questions you may have. It is now mandatory as of August 1st to submit CMS 1500 forms to a board-approved electronic submission partner. This applies to all healthcare providers in the workers' compensation system, regardless of office size or patient population. Out-of-state and out-of-country providers also need to partner with one of the 6 electronic submission partners. There are many benefits to providers. If you have not obtained an electronic submission partner, we urge you to do so immediately, as the board will not act on or enforce payments of pay for CMS 1500 forms submitted on or after August 1st, 2025, and the payer can deny them. We want to stress there is no opt-out option available for electronic submission of the CMS 1500. Now we'll take a minute to highlight the many benefits of electronic submission. First is faster bill payments. Providers typically get paid quicker. Next, we have reduced administrative burden. The electronic submission partner submits the CMS 1500 to the insurer and the board. Some electronic submission partners will accept paper CMS 1500 forms and convert them electronically. Providers will have confirmation within 7 days that their bill was received by the insurer, with date timestamp acknowledgement of receipt from the insurer. The provider is aware that they do not need to resubmit the bill. In most instances, technical errors are identified quickly, so they may be corrected and resubmitted instead of waiting for the insurer to deny the bill. And finally, no or low cost. There is a designated CPT code that reimburses providers for up to $1 per transaction. To make the electronic submission process as easy as possible, the board removed the requirement for providers to log into the medical portal and accept the agreement for electronic submission of CMS 1500 before working with a submission partner. This step was removed as of July 28, 2025. Providers can simply contact a board-approved electronic submission partner, and you can see the list on our website, and arrange for electronic submission of the CMS 1500 form. As the board has eliminated the requirement to complete an attestation to electronically bill, the listing of providers authorized to submit CMS 1500 spreadsheet posted on the board's website will be removed as of November 1st, 2025. Let's review the electronic submission process. Submit the bill and narrative attachment to the electronic submission partner by an agreed format, and they will electronically forward both to the workers' compensation insurer. Providers who wish to continue using paper bills will still have the ability to submit a paper CMS 1500 form to certain, but not all, electronic submission partners who will then convert it and submit it electronically to the payer and the board on the provider's behalf. Providers who wish to submit a paper CMS 1500 form must ensure the submission partner that they choose has this capability. There are submission partners who take paper and those who do not. The insurer will then accept the CMS 1500 form from the electronic submission partner and return electronic acknowledgement of receipt. The electronic submission partner will forward the acknowledgement, including the date it was received, to you. And the electronic submission partner will also transmit the billing data, CMS 1500 forms, and narrative attachment in the insurer's acknowledgement of receipt to the board. Now we will review some of the most frequently asked questions. Our first question, if providers are not enrolled for electronic submission as of August 1st, what happens to their claims? The answer is that if you submit a paper CMS 1500 bill on or after August 1st, 2025, the payer will not send you payment, but rather an explanation of benefits or explanation of reimbursement that references CARC 16, RARC, and 34 codes, which indicate your bill was not submitted electronically. In order to be paid, you must resubmit the bill to the payer electronically through an approved electronic submission partner within the statutory time frame or within 120 days from the day medical care was rendered. Our next question, is there no way to opt out of this? We're a very small practice. We do not have very many compensation cases. And the board's response is that all healthcare providers, regardless of office size or patient population, will be required to submit the CMS 1500 Universal Medical Billing Form electronically through a board-approved electronic submission partner, effective August 1st. Out-of-state and out-of-country providers also need to partner with one of the 6 electronic submission partners. Our next question, where can we find the list of board-approved electronic submission partners? The answer, the board posts a list of approved electronic submission partners on its website, including their contact information and pricing information. Check the list regularly, as it is expected that this list may change over time. Visit the CMS 1500 overview page on the board's website and click Electronic Submission Partners in the Quick Link section of the right side of your screen. Our next question, will more submission partners be available? And the answer is that it is expected that this list may change over time, so we encourage you to check the list regularly. Next question, my claims clearinghouse is not on the list of approved submission partners. Does this mean I have to use a different partner to submit workers' compensation claims? Not necessarily. If your clearinghouse does not wish to become a submission partner directly, they may work with one of the approved electronic submission partners. Clearinghouses are encouraged to become electronic submission partners. Clearinghouses interested in becoming electronic submission partner will need to register first with the board. All submission partners must test the CMS 1500 electronic submission and be approved prior to implementation. Next question, can a provider contract with more than one submission partner? Yes, but it is not necessary. If your electronic submission partner does not have a direct path to send a bill to a particular payer, it may be forwarded to another board-approved submission partner that will send the bill to the payer. When the payer acknowledges the bill, the acknowledgement date will be sent to your electronic submission partner from the one submitting the bill to the payer. When your submission partner receives the acknowledgement date, a copy of the bill with the acknowledgement date will be forwarded to the board. Our next question, how do providers offset the cost of electronic submission partner? Providers will have the ability to offset the cost of using an electronic submission partner by using code 99080. This was previously a no-charge NC code in the fee schedule listed as special reports such as insurance forms, more than the information conveyed in the usual medical communications, or standard reporting form, which may be used as a by report, BR code, up to a maximum value of $1. The code should be placed on the same CMS 1500 form for which the billable services payment and the electronic submission costs are being requested. The price listed by the provider for code 99080 should accurately reflect the actual cost incurred by the provider for the electronic submission of the individual bill, up to a maximum of $1. Please note this offset is just for the CMS 1500. Next question. Where on the CMS 1500 form do I put the code 99080 for electronic submission costs? The code should be placed in box 24D on the same CMS 1500 form for which the billable services payment and the electronic submission costs are being requested. The price listed by the provider for code 99080 should reflect the actual cost incurred by the provider for the electronic submission of the individual bill, up to a maximum of $1. Offset reimbursement is per single bill, not for each date of service or each CPT code. Please keep in mind when adding code 99080 to the CMS 1500 form, providers should input the last date the patient received services listed on the form rather than the date of billing. Our next question. Do we need to submit a narrative report along with the CMS 1500 forms or just a summary of them? And our answer is that providers must attach a narrative report with examination findings to the CMS 1500. The narrative report should include the following: history of the injury or illness, any objective findings based on the clinical evaluation plan of care, and your diagnosis assessment of the patient. Certain provider types must include information about work status, causal relationship, and temporary impairment percentage. All required information should appear prominently in reports. You can find examples of narrative reports at wcb.ny.gov/CMS-1500/requirements. And our next question, do we need to know the payer ID to submit electronically? Insurers and employers who have been approved to self-insure for workers' compensation benefits in New York State are assigned a 7-character identification number, which can be found on the payer's electronic submission partner lookup webpage. Additionally, approved electronic submission partners clearinghouses are knowledgeable about correct payer IDs needed to deliver electronic medical bills to the payer. And our last question, before we review your questions that you have already entered into the chat, do providers also need to upload submissions to the board website as we do now? And our answer is that when the CMS 1500 form and narrative are submitted to the board through an approved electronic submission partner, providers should not mail, fax, or email a duplicate paper form to the board. Your electronic submission partner should submit the required communications to the board on your behalf. For additional resources and all the details related to CMS 1500, including a list of electronic submission partners, FAQs, and discontinued forms by visiting wcb.ny.gov/CMS-1500. We also have a dedicated mailbox to answer all questions on the CMS 1500 initiative, and the email address is on your screen. It's cms1500@wcb.ny.gov. As a reminder, if you're not already following the board on social media, we encourage you to do so. We are on X, Facebook, Instagram, YouTube, and LinkedIn, so link up with us. You can also subscribe to get board updates, the same ones our external stakeholders do, by hitting Get WCB notifications on the bottom of our website. Thank you for joining this webinar to learn about how to become fully compliant with the new mandate. Before we take time to answer your questions, please take a moment to let us know in the chat if you are not already submitting the CMS 1500 electronically using a board-approved submission partner, what is holding you back? Please enter your response in the chat. And we will now take the rest of the time to answer your questions. You may hear a brief silence as we take some time to review the questions that have come into the chat, and we will rejoin you again shortly.
This is Dr. Tachi. There's a question about how to submit C4.3 forms. So C4.3 forms now will be the medical narrative report that you submit for any MMI or permanency determinations. So if you perform an exam in order to determine MMI and to evaluate a permanent impairment, you will bill for that using CMS 1500. So you'll use the CMS 1500 for the billing for the permanency evaluation using the specified codes. And then you will use the C4.3 form. You will attach it to the CMS 1500, and the the C4.3 form serves as the medical narrative for that submission. Do not submit the C4.3 form separately or individually, trying to use it to bill for those services, because it will not be reimbursed.
Hi, this is Audrey Cunningham from the Medical Director's Office. A couple of questions regarding the offset code. The first being, does the offset code, oh, one moment, I lost the question here. Is the offset code payable on a bill that has been fully denied? And the answer is no. The 99080 charge would not be reimbursed if the entire bill is denied. However, the offset charge must be reimbursed if the claim and bill are ultimately found to be compensable.
This is Dr. Tachi again. There's another question that asks whether the 8/1/25 date refers to the date of service. It does not. It refers to the date of the billing submission. So any bill submitted now and any bill submitted after 8/1/2025 must be submitted electronically through an electronic submission partner, irrespective of the date of service that's being billed.
Hi, question regarding payer IDs. Payer IDs can be obtained from an individual provider's submission partner. So we encourage you to speak to your electronic submission partner to obtain the valid payer ID for the carrier.
There's a question, does each date of service require a narrative template and a medical note attached? And the answer is yes. You must submit the medical narrative and documentation for every date of service being billed.
Hi, there's a question as to whether or not the submission partners are sending the electronic bill to the board, and the answer is yes. So if this is coming from a provider, if you send your bill as well as the supporting documentation to your submission partner, that submission partner is then required to send the bill both to the board as well as to the payer.
There was a question about if this video is recorded, the presentation. Yes, it has been, it is being recorded, and it will be put on our website as well as the board's YouTube page.
Hi, another question regarding the offset code. If there are several dates of service on a bill submitted, the offset code is for the last treatment date for the injured worker. Another question regarding the offset code. Keep in mind that the offset reimbursement is per single bill, not each date of service. As I mentioned before, there could be several dates of service on a particular bill, but the offset reimbursement is per single bill, not date of service or per CPT code. Hi, there's a question with respect to a provider who's working with a submission partner that is not on the list of board-approved submission partners. We encourage providers to speak to their clearinghouse. If the submission partner is not a board-approved submission partner, they likely may have a relationship with some of the board-approved submission partners. So talk to your current submission partner, and there may already be a relationship with the board-approved submission partner.
Hi, there's a question asking, do we fill out the 1500 form and then submit to the partner for board submission? The answer is yes. You're going to complete your CMS 1500 form, submit it to the XML submission partner, and then they will send it to the payer and to the board.
Hi, a few questions as to whether or not providers should be contracted with submission partners now that it's post-August 1st. And the answer is yes. If you are not yet signed up with an electronic submission partner, please contact one of the board-approved submission partners. They are listed on our website. We recently updated the website with all of the contact information, pricing information, so we encourage you to contact these submission partners as soon as possible because any bill that is submitted now post-August 1st that is received via paper can be denied by the insurance carrier. So we really encourage you providers out there, if you haven't contracted with a submission partner, please contact them so that your bills are properly reimbursed.
It looks like there's a follow-up question on the C4.3 form, which states, so the C4.3 has to be submitted with the clinical. I assume that means with the clinical notes or the medical notes. And the answer is yes. If you're performing a permanency evaluation on a patient, so if you're determining MMI and giving a formal opinion on permanent impairment, the form has to be completed in order for you to be reimbursed. That form, along with any other medical notes from the clinic visit that you would like to include, have to be included as an attachment to the CMS 1500 form for billing purposes.
The question, a follow-up to the earlier question regarding any bills that are received via paper now that we're post-August 1st. So the answer is any bill that is received via paper and not electronically can be denied by your insurance carrier. If you are a carrier out there, that bill, if you're denying a bill that is received via paper, we suggest that you not submit a C8.1B for that reason, rather indicate as such on the explanation of benefits using CARC 16 RARC N34 to deny a bill that is received via paper. For you providers out there, if your bill is denied because it was submitted via paper and not electronically, you must resubmit within 120 days from the date medical care was rendered in order to be reimbursed. Hi, question regarding whether or not supporting documentation is required for using the offset code 99080, and the answer is no. But keep in mind the price entered for this code should reflect the actual cost of the electronic submission for a bill. So it's up to $1, but it should reflect what your submission partner is charging per bill. Hi, follow-up question regarding the offset code. The offset code is per bill, so it's not to be attached per CPT code, but it's per bill. So if there are several dates of service on one bill, the offset code would be for the last date of service or the last date that the injured worker was seen.
We've had a couple additional questions regarding the webinar being recorded. This is being recorded and it will be posted on our website and YouTube page in the coming days. We'd also like to try to get a little bit more feedback from you here. So if you are not already submitting CMS 1500 bills through an electronic submission partner, we want to know what is holding you back. Can you please let us know in the chat? Thank you.
Hi, a few more questions regarding the denial of paper bills post-August 1st. The answer is yes, your bill, if submitted via paper, can be denied by the payer. So we strongly urge you to reach out to one of those board-approved submission partners and start the process. It may be as simple as just signing up with them so that you can ensure that your bills are properly reimbursed. So please, if you haven't signed up yet with a submission partner, please do so. On the same note, a little follow-up here, whether or not payers are required to also have submission partners, and the answer is yes. Payers are required to partner with submission partners. That requirement has been in place for a number of years now. So please make sure that you reach out to those submission partners. Hi, a few questions regarding providers from small offices that may be concerned about the cost of using an electronic submission partner. That's why we have the offset in place. So if you are a smaller practice, the offset is in place to offset some of the costs of contracting with the submission partner, but we hope in the end that this will make your life easier, whether you're a small practice or a large practice. So please reach out to them. And again, the pricing and contact information is available on our website. Hi, a couple of questions as to where a provider may obtain the CMS 1500. The CMS 1500 is a universal form. It is available online. You may also be able to obtain it from your submission partner. But again, this is a form that is a universal form and should be available online.
All right. Well, thank you to our subject matter experts for all your time and expertise, and thank you to everyone for joining us today for this excellent Q&A session. In case you missed any responses, the Q&A will be included in the recording that will be available soon. Any questions that were not covered during the Q&A can be directed to cms1500@wcb.ny.gov, and someone will respond to your inquiry as soon as possible. And before we sign off today, I would like to remind you to sign up to receive workers' compensation news, including information on future webinars, straight to your inbox. To sign up, visit wcb.ny.gov, scroll down to the bottom of the homepage, and select Get WCB Notifications. We also distribute information via our social media channels, so please follow the board on Facebook,